the effects were the financial disaster that we are living our way through right now.
We are in the most serious financial crisis in generations.
We're building new technology to help the world, and we're being treated like criminals. I knew it was going to be big. I didn't realize how massive it was going to be.
They better pay a little closer attention to the law, or the SEC is going to pay closer attention to them.
Yeah. Our partners received subpoenas today from the SEC when I'm trying to build technology that will make America more prosperous for everyone. This is America, and we will fight for our freedom to defend what we've built. The rest of the world is going to leave America behind if we push this technology out. It's all at stake right now. Hello, everybody. Welcome to episode 0x28. Super happy Dragon Lucky. I'm Joe, and we're going to start. With a coronavirus update. Everything is continuing on as we all expected, I guess, and they're pushing out dates in mostly the big cities, the bigger states, New York, Washington, California, right? And trying for whatever reason to keep things closed down longer than probably necessary. But we'll see. I'm hearing stuff about requirements for masks in Washington State as well, which I couldn't find the actual source of that, but I'm going to look into it because I've not been wearing a mask as much when I go out. I mean, at least not when I'm out in normal public in the open, but either way, we'll see. And there are a lot of crazy things going on. One of which that we wanted to bring up was the Google and Apple APIs. And though I've not delved too deeply in, it seems that they are pushing an API or APIs, and I don't know if it's a standard. I don't know what they're trying to do in particular, but wherein they can do contact tracing, or that they will approve apps that use this API for contact tracing. The issue is, at least seemingly for good reason, that they don't want centralized data to be stored, which, being as it is Apple and Google, really interesting that they would take that tack, because obviously, they are storing everything already where everyone is. And, you do have to think, well, maybe we could use this because they could see where contacts have happened and potentially trace back. But the problem is tying that to, in my opinion, at least, is tying that to medical info that someone would then therefore likely have what I would expect would be, medical info leak. Maybe it's anonymized, I don't know, but either way, we do think there are other ways. Even if you want to do a purely geospatial based contact tracing, that we will talk about a little bit later in the show here. And it's an interesting point whether you're using testing data, things like that, or whether you are using actual geospatial tracing to know where people are, and how that affects privacy in particular, and to see what direction nation states and in the US, states and counties take on some of these things. So let's see here. Next up, we'll go into DIN trending. And, if you haven't gone on, do come into DIN and see if, play around with it, try out some of the new features. They're really pushing stuff out fast. And we have a couple of really important things happening really soon. That in particular with the lore and lot, so the ownership of layers, and turning on the layer creation process for the community, and all of that as we roll DIN out as a new entity. And also too, here's something, if you can click into the CryptoCrow article there, that I do have something happening today at 12 Pacific, so 3 o'clock Eastern. I'm at least as of now supposed to be on Crow on live, and I don't know if that'll be video or audio. I haven't asked him yet, but either way, there should be a live broadcast today at noon Pacific, 3 Eastern. So, and if you can go back, maybe go to DIN updates, the DIN release, and we can maybe from there, I could give you a couple of quick, because there were some really important info on basically that you can disable or enable notifications layer by layer, which is going to be really important when we finally get to mobile app rollout. Image view it's much better with collage, grid view, and a carousel, so it opens up. It's a little more what people will expect. Videos will start playing automatically, so it's not as many clicks, things like that. Very, very simple. Then we did get in some really good bug fixes, and so appreciate everyone reporting the bugs and you know what's going on behind the scenes. You know, we're trying to capture and prioritize everything we can, and the community's been really great about giving feedback, and we're starting to see some pretty good traction, SEOs picking up, things like that. So that's probably enough for DIN. The CryptoCrow, watch that live. He did put a video together. I should have said this earlier, right? That actually gave a pretty good high-level rundown of everything that we are doing, and it's going to be great to get on there, because I want to know what he, which topics he really dives into, because there's a lot to talk about. And in that video alone, he talks very much about the fundamentals, the philosophies around it, talks about the technologies, talks about our focus, talks about bear market and how we've been building nonstop. And he got a lot of things right. And I'm going to have to apologize to him, because he's been trying to get a hold of me for quite a while, and we'll typically talk to each other hours apart, and haven't been able to get anything scheduled until last night. So I think that's mostly because I've been on DIN more than Telegram, and I've been focused on some things in Twitter instead of Telegram. So apologies for anyone who's been trying to get in touch. There are a lot of people out there. So okay, lots of good things happening, and we're going to now bring in the team, some of the team from our project with Medek Health Services. And so we're going to bring in Jan and Robert, and also from and so Jan and Robert are from Medek Health, and then we're going to bring in David from Dragonchain dev team, core dev team. Hi guys.
Hello. Hey.
So mostly today we want to talk about the project as a whole, both the business, the high level, and some of the technical, without taking too much of the team's time. But Robert, would you want to talk about what started the project and how we kind of made things happen?
Yeah, absolutely. So again, my name's Ryan, and I'm with Medek Health, and I haven't done one of these in a long time. So prior to this, I was backstage. I was practicing doing my unique New York, just practicing trying to talk here. So I apologize. I'm not on the camera as often. So we what we wanted to do is we wanted to find a way to bring confidence back to businesses. As most people probably watching this know, businesses were shut down, and even after they said, "Hey, we're going to reopen things," we said, "Well, there's a consumer confidence issue that even if they open the doors, all of a sudden now, my wife, for instance, said, 'Oh man, I just don't know if I want to go in yet. I'm just concerned that maybe the virus is still there.'" So we said, what if there was a way to bring confidence to businesses and to be able to provide a technology tool to be able to do that? And so we got together with Dragonchain and our team here, and Jan and myself and a couple others on our side. We said, how do we build a tool to be able to do that? So one of the things that we said is we wanted to build an assessment tool. So Apple has a really great assessment, and there's a couple others out there. So we wanted to build an assessment piece, and then we wanted to take it a few steps further, and also be able to provide the ability that if you do get tested, to be able to securely and safely, and with the accountability utilizing blockchain, to be able to load in test results and still be able to own that data yourself independently, and then you can choose kind of whether to share that. So we wanted to be able to provide that as a tool. We have been partnering with a city down here. We're in Central Florida. So we partnered with a city in Central Florida named Apopka. And what we're doing with them is we're providing them this application we're calling the SafePass. So once you get through the assessment, you're issued a SafePass based on an algorithm that the team came up with that's based on health, occupation, location, and a number of other factors to be able to say, hey, you are either a higher risk to others or you're probably safe to go back to work. And so with Apopka, we are working with those guys, and we're essentially giving the application to businesses so that they can have their employees take the assessments, so that, for instance, let's say, Bistro on 43rd, the Bistro knows, hey, all our employees are all low risk employees. And so the mayor is giving a gold seal if you're following strict guidelines, which include, face masks for employees, having a low risk SafePass, and they actually are going a step further in checking temperatures. So all of that data gets put in there to be able to say, hey, this business here is following these guidelines, so it's most likely a safe business, and because of that, we're going to issue a gold seal. So we're a part of that gold seal program.
Nice. And by the way, I mean, that's interesting and pretty important, because the assessment and the survey is built out. We're waiting on approval from app stores, things like that, right, Jan? It's interesting to me because the flexibility of the system, where we can plug tests in, we can plug so we can plug different inputs in as they become available, and as other groups participate. But then we can also plug in different types of result sets, right? Like we have the SafePass score integrated right now, and we can theoretically integrate any particular workflow, right? And that was some of the fun part of what we saw when the project was brought in. We're like, oh, we can do this, and so Jan and David, I mean, you want to talk about like, say, in particular, I think I've not, time is a blur for me typically. So tell the audience how long it took to to build out this first phase with smart contract integration, mobile app, API, and reporting front end, things like that.
Correct me if I'm wrong, Ryan, but I think 3 weeks since conception until we were done. Now, of course, we're waiting on, like you mentioned, Joe, on approval from the stores. But the app itself has been finished for a week now, over a week. And yeah,
That's a lot of 5 a.m. nights to get that, but
not so much, just a few.
Yes.
Yeah, it wasn't hard to do because basically the app is made in Flutter, so we were able to use a single code base to target both platforms, and Dragonchain has a Flutter API as well. So implementing the Dragonchain APIs in the app was pretty straightforward and fast. By the way, I see that the site is now, you're looking at the site. You can actually take the assessment right now on the website if you want.
Nice.
So even though the apps are not live on the stores, you can do that. And you can definitely go with that and show it to everyone that needs to see your score, your risk score.
Nice. And I know that they're working on some other, partners coming in, and it's a system and a platform that looks like it will develop further and keep adding value. So
Definitely.
In particular, I think even after COVID, I think you could apply it to a lot of different similar things. So
well, one of the things we're doing, Joe, is being able to not only can you, once you get your assessment and we provide some feedback like, hey, we recommend you should probably quarantine at home, or we recommend you're safe, go back to work or get tested. But one of the other things is we allow a set of tools to be able to then take that next step. So built into the application, and this will be in our next release, will be the ability to speak to a telemedicine provider if you have further questions, or the ability to be able to locate your actual testing locations, so you can do it all from one source, one location. And that platform, again, is one platform, but it can just keep expanding and building out, because all the framework to keep it secure and flexible is all getting built now.
Mm-hmm. Yeah, and so David, how long? So the smart contract. So there are a bunch of ledgered entries. So the survey, later the tests, later the evaluated tests from medical professional or clinic or whatever is in the workflow, all feed into a scoring smart contract, which takes whatever algorithm the smart people put together, the medical professionals that say, okay, here's how we're going to score, here's what the score means, all that stuff. How long did that take? Because you had sets of inputs, and you had to pull a score. Jan has to pull it from mobile app. It's all integrated.
It took about a week. It was pretty straightforward in terms of implementing a smart contract. We actually, and it uses live data as well. So when it calculates a score based on your location, it will actually do a lookup for the total number of cases reported for that location. So it's actually using live data, which is actually really cool.
That's really nice, yeah. And is that how is that live data brought in? Is it is it actually pulling from either the CDC website, or is it a file that is daily or something?
Yeah, it's like a file that's updated daily.
Okay.
But
it's coming from the CDC. So
yeah, that's nice. That is that the county by county, by the way?
Yeah,
you asked that. So okay, yeah, that's all. That's really cool. Okay, and it should be noted as well, and this is the weird thing that I haven't even talked to the team about, because I just started getting prompted about it yesterday, and I realized, a lot of out there, the news is focused on contact tracing, which everybody assumes is geospatial contact tracing, which would be something that big government would want, because they could not only know how many people have been tested positive in this area, but they would potentially, theoretically, and they do, be able to tie this person who was tested positive, or whatever assessment did come into a geospatial intersection with these other 10 people. Therefore, did they get it? Whatever else. I mean, that would be amazing data if it weren't privacy, right? Controlled, and it's stuff that nobody wants their information used like that, or at least
we don't even track. We don't even use GPS on the phone during the assessment or anything. The only way that we actually help in that regard is that when you go to a, let's say, restaurant, whatever, and you sign in with your app there, again, your choice, if you want to sign in with your app in the restaurant, then we will know if someone in the restaurant is a high risk, for example, or whatever. Then we will be able to let the people that came in that time frame and let them know, hey, you might want to get tested or whatever because we have someone that was a high risk.
Yeah,
But
and all
Right.
that can be
we
done
don't know who that person is. I mean, that's completely anonymized. We don't
Right. And theoretically, you could either, if the restaurant wanted, they could require, or maybe they say, oh, if you they incentivize it, you get a better seat or you get a discount if you are low risk, right? Whatever. I mean, but it's usable in that way where people could show this without showing any of the source data behind it. And it was interesting as well. And when we brought it up with the PhDs, I mean, the medical people on the team, they were surprised, I think, and interested when we told them that, well, no, we don't need a HIPAA waiver or anything because we don't have to expose, even if it's a company, a customer, we don't have to expose the actual test results or the actual privacy data. We can basically expose just an assessment or an evaluation, whether it's by a doctor or whether it's by the smart contract algorithm, which you could get to that 88 score a number of different ways. So and or if there was some other piece applied to the output. And the reason I even brought up the geospatial is I worked on a project in the past that, I mean, theoretically we could use the same model that if it matters, right? Like say, if we wanted to include a geospatial, because I saw that I believe Netherlands and maybe some other European countries were requiring, or at least strongly advising, that people run this app, which does purely trace them, that we can very easily, and I'll tell you, solve the issue where the person can hold all of that geospatial data, the whole path that they took, and only when they totally explicitly say yes, share this, would it'd be anonymized. But and the reason is that let's say someone does test positive in one of these regions that wants to do this, they could, without exposing even the privacy locations, let alone the medical info, they could say, okay, we have an anonymized source of data that has a path through, and they could push that up, and me on my app, which my app on my own device has all of my location info, can say, oh, when you went to the grocery store yesterday, you were within 3 feet of someone who now says they had it. Right? We're not going to tell you when, we can't tell you any of that, but we know that there was an intersection. We could do that. We aren't, right? But the beauty is, if it were a requirement for one of the customers, I mean, we could do it and still honor all the privacy and HIPAA and whatever local regulations are with that. And it should then be mentioned too that the app, as it currently will go out, does have a decentralized identity component, which the first phase was when you sign in, it's totally anonymized. There's no how do I say, there is no tying it to any of your personal information, but it is basically generating a cryptographic key pair that is tied to an identity component on Dragon Factor, and that as time goes by, that can be like say tied to your email, your phone, whatever the team decides, so that you can recover, especially if you end up with test data in there or something else. And by the way, the test data would be totally dissociated, that only you can prove that is your test data, right? That the system doesn't know whose test data it is, even after it's tied to anyway. So we go into all that. I don't want to get too much depth, but it's an interesting system. And at least in my opinion, really, really well applied to this use, right? Decentralized identity, there's a lot going on about that, but people owning their own data, people using their own data as they wish, and not the other way around, not the government coming in and say, oh, we see you tested this way, and you walked out and mowed the lawn, right? The craziness can be a little more controlled, and yet people can have enough information to know, we had talked early on that, a restaurant can even show, as an example, a report so that you can see everybody that's in the restaurant and the kitchen has followed whatever the mandated process is, whether it's the some standardized process that the restaurant itself is using, or whether it's the state mandated thing. Let's see here. And we should mention, the team really kicked butt. You guys were staying up really late. I know, on our side, I saw the devs working late, and I know Jan was typically very tired, so staying up all night. But we got it out, we got it going, and hopefully app stores will approve it. I think they are, at least on the positive side, trying to make sure that they don't get any bad apples in, right? They don't want it to.
Yeah, they basically don't want anybody doing apps for COVID that they don't have credentials for it. But
right,
that's what they asked for us and what we provided, and I'm guessing they are analyzing all that, like medical requirements, the fact that we are working with a city. It is not just because we wanted to.
Right.
So,
right.
Yeah.
On the website, are you using the Flutter Web, or is it?
It is
Scratch. Really, it's Flutter Web.
Yeah.
Nice.
Not this one that we're seeing right now, but when you go take the assessment, yes, that's Flutter Web.
Nice. Okay. All right. Next up, you guys ready for some questions? I think there's some good questions.
Sure.
So, Mike Iannuzzi, Medek Health team question: what is your timeline for expanding to the rest of the United States? Also, any other ways that you can use Dragonchain tech?
Yeah, that's a great question, Mike. I would say, so, obviously, like Jan had mentioned, we really pushed hard in that 3-week period of time, and so there's a lot of refinement that is still kind of getting built out. And this city of Apopka, really taking the reins and saying, hey, we want to be the first city to really embrace this. I think we're going to learn a lot of lessons from that, just proper use cases and things that we had no idea. I'll be the first person to tell you, I just don't have all the answers. So we're learning. But as far as rolling out to the rest of the United States, I would love to do this as soon as possible would be great. But I think that's more of a little bit of a sales effort, right? Of getting in front of the right people and talking and building some adoption. So hopefully everything going with Apopka goes well. Other cities will see that and say, hey, look at this. They're doing this. This would be a great model to continue forward. So
let me just add that the app itself is going to be available the whole United States. So whoever wants to use it can.
Right. Because it doesn't have to be state mandated, right? It's whoever wants to use it can use it. So yeah.
Exactly. Yeah. The only thing that we're working with Apopka specifically is because they have, like Joe mentioned, that we can add like specific requirements per state, city, whoever. So that's just a matter on the business side. What's the requirement for their gold seal that Ryan mentioned? So, but that's just a case-by-case basis. We will have like a set of rules, and the business can choose, okay, which one is required. But other than that, the system itself is ready to go anywhere.
Yeah. And David, maybe you could answer the piece about the additional tech.
Well, you could use it in many ways. It's our smart contracts are very versatile. They're Dockerized, and you could really use any language you want. So I guess if you wanted to build like a supply chain tracker or anything that, or like a transaction processor, really, like, the possibilities are endless in what you can build with a smart contract.
Right. I mean, there's a bunch of stuff that even that we can plug into this platform itself that would really expand the use cases. We mentioned testing kits, so clinic-based testing, hospital-based testing, at-home testing, where available, where appropriate, can be plugged in. That theoretically, you could have antibody tests, the actual viral tests, all pluggable. They can even potentially, if we had the right partner for integration, and I know on our side we're working on a couple of things that might fit into this. There could even be basically hospital records based eval of prior conditions, which could really improve the assessment, right? On, we know that you had this prior, or that is, that you had this prior, your doctor knows that you had this prior, and you can prove that with that prior you are at this level, so maybe you shouldn't return to work, that type of thing. All different types of pieces, but the whole thing for us is the provability. So if you have a record, and you have a credentialed agent like a doctor or a hospital saying this, we're saying at this time that it's true, that anyone in the future can actually point to that and say, okay, that really is a credentialed medical professional, RN, doctor, whatever else, because I can look up.
Yeah, we don't even need to store that that result. We just need the answer from the doctor. That's it.
Right. And the beauty is that information, which I think is maybe the counterintuitive part for a lot of the people who are used to some of the traditional systems, the beauty is that data does not have to be centralized. I mean, it can be if it's necessary, if it's a CAT scan or some big piece of data, but the data can be decentralized and can be offered up for explicit exposure and proof to a particular person. Like, I could show a person, here are these records that you need to see in order to treat me, and I can prove that they are legitimate. I can prove that the data is of quality, that there have been no changes to this data, and I can prove that it was approved or actually this test actually occurred on this date, which is everything. Because otherwise, you have mistakes, but you would also have the potential otherwise to say, oh, this is me, and it really isn't, right? And maybe you're not safe. But with this, you can tie everything together, but still protect all the privacy. So I think there's at least one more question. Spunner 999, how to incentivize the usage of SafePass? Will the city of Popka enforce it? Oh, interesting.
Yeah. So the way the city of Apopka is currently doing it is they're incentivizing businesses based upon this gold seal. So while businesses aren't required to, if they're open, they don't have to have the gold seal. The idea behind the gold seal is to say, hey, these are our gold seal businesses. These are the businesses we're going to promote. So you get a little bit of that marketing to say, hey, these are our safest businesses. And then you can imagine there are opportunities to be able to integrate into the app, to be able to say, hey, you're in this region. Let's take a look at, if you're in the city of Apopka, let's take a look at, I want to eat, what businesses are currently gold seal businesses in my current area. So there's some ways to, or at least the city's looking at to try to promote it. But the idea is that if given the option between a gold seal business that is doing things right, wearing face masks, checking temperatures, our employees have the SafePass, versus a business that maybe doesn't have that, all things being equal, that you would want to choose that business with a gold seal. So that's what they're doing currently, which I'm a big believer in choice. So I think that's helpful.
That's nice. Yeah. I think also that, basically for businesses opening, theoretically, we should maybe talk about whether we'd want to put a certificate on one of those gold seal businesses. Let someone say, oh yes, they are auditing, they're following this process, all their employees are using it, and they're whatever it would be that you could put something in the app to do that, even to find what businesses are near me with that certificate. Either way, that's great, and depends upon what it is. Like say if it's not a city, if it's a company, that the company can say, look, we want everyone to do this here. If you come back into the office, we need to have this evaluation happen, including whatever specialized inputs, if they want tests or not, and whatever makes sense. And that would be not state sanctioned, but it would be the actual business itself. We want for your own good as you come back in and with your other colleagues, but also for our customers, or depending if it's retail customer facing or not. But the incentives can be less than public sector, right? But there's a lot of it's like they could do tax breaks, right? Somebody should do tax breaks for anyway. So did we, Blake, did we have any more questions? Let's see here. I don't know if we want to talk about how does SafePass make money on 999. I mean, I know it is monetized, right? I know that it is a system. So, yeah, Brian, you can.
Yeah, so I think we're still trying to figure out how this is going to work. So part of one of the things that we've kind of initially concepted, and by the way, if anyone else has any great ideas, I mean, we're all ears, right? But I think one of the concepts that we have right now is to be able to say, okay, let's say you're a business and you want to be able to have this application and be able to do, be able to integrate in, like, for instance, one of the ideas we had is being able to, if you're going to take temperature checks, all that data could get brought into the application. You could scan a pass, capture a temperature, using a Bluetooth thermometer, or even manually entering that data. So being able to provide a few more business tools in there, and then being able to say, okay, this is going to cost $1 or $2 a month per employee for that business.
Yeah, basically business side. I mean, the consumers it's always going to be a free app to make their own assessments and to comply with whatever. Let's say we were talking about, like, I don't know, you want to throw a birthday party for your friends or whatever. You might say, hey, you want to come in? Show me your SafePass.
Mm-hmm. Right.
You can do it.
And I do know that there is also opportunity where we are talking to a couple other groups about test kits themselves. So there will be cooperation along those lines too, because then when the companies are coming in, they will be potentially buying these various test kits depending upon where they are, what kind of business they do, and what's available. And all of those, are, there are margins everywhere, right? Yeah. There's nothing wherever anything is overpriced. In fact, I think when you guys came to us, it was really interesting because I didn't even know that the one antibody test was being used out there, and that it is cheaper, right? So there are interesting angles on using certain tests when you need to take them more often versus the bigger, more expensive test when you really need to know a state, right? So all of that can be worked in, and there's a workflow to it. So it's pretty interesting, and then the HIPAA compliance side, which obviously is a huge factor in the U.S., but I don't know what the penalties are, but it's scary stuff. I never want to touch upon anything where you mess up with medical data. And that's why, I mean, by the way, it's interesting a lot when we even at Disney, it was a way for me to describe really clearly to the powers that be why this technology is important, because they're dealing with and you guys are in Central Florida, right? So they're dealing with their customers being general public and financial data. They have financial products as well, Disney Vacation Club, all that type of stuff. But then also their medical data, right? I mean, there's stuff that a company cannot expose, right? And that's, like, say, some of the power of blockchain technology is you can still allow a person, an individual or a company to prove a record, to prove that, the three of us got together at this time, went through this workflow. That was, let's say it was last February. And this was the state of every step and the result, and potentially even an evaluation that does not expose any of that data. And you could selectively expose the whole bit of data. You can selectively expose the evaluation. So it depends on who you're showing it to. It might be at some state sanctioned proof where they actually, for whatever, let's say it's not in the US, that they want to know that you actually went through this process. You can literally prove that the process happened. You can prove who was a participant in that process, the doctors, the nurses, who actually took the test, who took the, the test evidence, what the source of all of the survey questions were, all of those things, without coming upon a HIPAA violation, without exposing that information at all. And that's radically powerful, and that's all about blockchain. And that's why, and it's a combination of technologies. I mean, Dragonchain's hybrid tech comes into play there, because the node itself is protecting that business data, and in this case that user data. But then the decentralized identity takes that step quite a bit further, where the data, the customer and business data that we are protecting on that Dragonchain node, that business node, is tied to data that it doesn't have, right? It's interesting because the consumer holds that data. Even if you came to us, we couldn't tell you who it was. We couldn't tell you that this was your data, but you could prove that this was your data. So there's a lot of really interesting pieces to it. So we took verify for me, guys, that we took a really good conservative tack on this to say we're not going to hold anything that even potentially could be an issue. We're like saying, okay, we don't need to hold that, right? It's pretty beautiful, if you ask me.
Even if you wanted to, since we are talking about, like you mentioned, about medical record and stuff, we have to comply. So
yes, yes.
Both, yeah.
Okay. All right. So I think those were all the questions. Let me see if we had anything last minute. We will say, can we expand the app to Europe? I guess, can you tell in the App Store, is it open? Because you can select that. Is it open worldwide?
It is. I mean, it is, right now, because like I said, the assessment itself, I mean, this is a global virus. And of course, the assessment is based on American doctors, and the CDC guidelines.
Mm-hmm.
So that itself right now is based on US standards. But that doesn't mean that we cannot plug in Netherlands standards. If we know what those are, we can definitely make the assessment be that, and make you, So
we need to reach out to Jeffrey Netherlands, right? I think he knows the Queen.
Really?
That's
so
what
it's like I think we need to ping him. But one way or another, it's if that's true that they were all denied because they didn't ensure privacy, that's interesting, because I think we can I think we can actually prove that whatever GDPR, whatever privacy standards they are talking about. I don't know if they have health privacy also, but we can definitely do all of that. So I'll take a note to someone over there. I don't know who. I'll wear orange when I'm doing it. This should be good. So okay, the last question I'll have is, when was everyone's last haircut? Right.
God.
I think yesterday.
Okay. Good. All right, Robert.
Well, I'm starting to get really shaggy, and now the sideburns are starting to come in too. And actually, what you can't see, my face hair is growing a little bit now, but I actually had a strong mustache for a while, and the guys in my office were just like, "What are you doing?"
Nice.
But it's probably been a month and a half. 2 months maybe since I've had a haircut.
Okay. Okay.
I think the most interesting question is last bath.
Oh, man. All right. Well,
Oh man.
David, you can answer either one of those.
It's been a few minutes, like a few months actually, for my haircut. My hair's starting to curl. It's like it curls over my ears. It's like
I have a couple of I've had a black market haircut. So
Oh man.
there's a place in Redmond that was open 3 weeks ago even. So I'm like, oh, I didn't know that they were allowed to be opened yet. But one way or another, I think that's funny. It's like I was tempted. It's like, oh, I'll just go there just because. But anyway, yeah, I've black market haircut. Probably a week.
Yeah, I tried to get my own shears too, and they're sold out everywhere.
Well, I think they stopped making Flowbee, right? If anybody remembers the Flowbee ads from, do you remember those from the 90s? No? All right. It's like basically an attachment you plug into a vacuum cleaner and you put it on your head and it cuts your hair, but you put a different length on the end. So if you want long hair, you just do that.
Really?
I know a dude out east that still has his, and his main thing is like they stopped making them, so he protects his, keeps it well oiled.
My wife has been trying to cut my hair for a while. She keeps begging me, Ryan, let me cut it, and she has no shears, by the way. So I don't know what she's going to use, like the steak scissors or something. But I can't let her do it.
That's awesome, man. All right, so that's it, everybody. Remember to subscribe. Remember to like this video, everything on YouTube, where it is, or wherever you see it, on Twitter, on Periscope, retweet it, and try to say, remember that Dragon Energy is love, right? So that's everything. See you all next week. All right, bye.
Thanks, guys.